Most people know only one thing about glaucoma, that it is an eye disease. But in reality, glaucoma is one of the most dangerous diseases for vision. The most dangerous thing is that it often develops very slowly and may not cause noticeable symptoms for a long time. That is why it is often called the silent thief of sight. In glaucoma, the optic nerve becomes damaged. The optic nerve is the most important pathway that transmits visual information from the eye to the brain. If this nerve is damaged, vision gradually deteriorates. The most unfortunate fact is that modern medicine cannot restore a damaged optic nerve. In other words, lost vision cannot be recovered. That is why early detection of glaucoma is extremely important. Many people think that if their vision seems good, everything must be fine. But glaucoma is exactly the type of disease that may not affect central vision for a long time. At first, peripheral vision, the side vision, begins to deteriorate. A person may not notice this. The brain often fills in the missing visual areas. As a result, the person feels as though their vision is normal. For this reason, it is important to understand who is at higher risk for glaucoma. People in risk groups should undergo regular eye examinations. The first risk group includes people over the age of 40. As we age, the circulation of fluid inside the eye may change. This can lead to increased intraocular pressure. Elevated eye pressure is one of the main factors that damages the optic nerve. That is why it is recommended to regularly check eye pressure after the age of 40. The second important factor is diabetes. Diabetes affects blood vessels throughout the body, including those in the eyes. In people with diabetes, the blood vessels of the eye and the optic nerve may be more vulnerable. This increases the risk of glaucoma. Another important factor is heredity. If your parents, grandparents, or close relatives have had glaucoma, your risk of developing the disease is higher. This does not mean you will definitely develop glaucoma, but the risk is increased. Therefore, people with such family history should not delay eye examinations. Another risk factor is high blood pressure. When blood pressure is elevated, circulation in the blood vessels of the eye may change. This can affect the nutrition of the optic nerve. In some cases, this may also contribute to the development of glaucoma. Sometimes a person may have several risk factors at the same time. For example, someone over 50 years old who has diabetes and a family history of glaucoma. In such situations, eye examinations become especially important. Another difficulty with glaucoma is that it does not always occur with high eye pressure. Some people may have relatively normal pressure, yet the optic nerve can still be damaged. That is why relying on a single measurement is not enough. A comprehensive eye examination is necessary. At Ko'z Nuri Clinic, glaucoma is not diagnosed solely by measuring eye pressure. The optic nerve is examined, visual fields are assessed, and modern diagnostic methods are used when necessary. This allows the disease to be detected at an early stage. If you are over 40 years old, if you have diabetes, or if glaucoma has occurred in your family, do not delay an eye examination. Glaucoma can slowly and painlessly take away vision. Write in the comments, is there anyone in your family who has had glaucoma? When was the last time you checked your eye pressure? If you have questions, feel free to ask. If you want to know the true condition of your eyes, visit Ko'z Nuri Clinic. Glaucoma detected early can be controlled. Glaucoma detected late can seriously damage vision. Do not wait until vision is lost. Protect it in advance.